Morning. My name is Harrison Pierce. I'm the chairman of the Health and Human Services Commission. Thank you all for attending, and it's good to see you all in person. This is our second occasion of doing such. It's like a couple of weeks ago when we had the drought and we were all in the rain, and then we got rain. But this is a nice autumn morning to pick off Health and Human Services meeting. Let's see. First item on the agenda. Approval of the September 1st minutes. Any comments, corrections?
I just had one question, Mr. Chairman. Page 9, paragraph 2. I didn't believe that Kevin Moynihan was at our meeting, at our last commission meeting. I mean, that may have been his position. I don't disagree that's his position, but it says Kevin reiterated his belief. In the second paragraph, page 9.
Page 9.
Kevin wasn't at the meeting last time, so
First, we're talking about the first selectman mentioned
yes.
that in the future you can maybe in need of someone for general
No,
communication.
second paragraph, further, first selectman Kevin Moynihan reiterated his belief that the town, that sentence.
That the town might get involved in domestic violence cases.
Yeah, I do believe that's his opinion, but I don't believe that he was at the commission.
He was not, but he did tell me.
Okay, so maybe it shouldn't be worded that way then.
Well,
I'm just saying, when you have someone, you say they reiterated at the meeting and it's in the minutes and they weren't at the meeting, it's probably not appropriately stated that way. I never have a comment on the meeting minutes because they're always perfect, but in this one case, I just
Made the comment about Kevin.
I think,
Harrison.
Well, maybe it said the chair
yeah.
quoted that Kevin Moynihan.
So it's a page 2. One comment I'll have is that I don't know how many of you attended the vigil. I attended a few of them. It was very impressive, as it always is. And it's the speakers who listened from the state of addiction, what they go through in the process. It's deserves lots of respect and admiration and support. So it's what we do involved in that. And one of our previous commission members, Lance Minor, was very involved in that. He was there, so it's hats off to them for what they do.
Yeah, I think Paul Reinhardt and his group just put their all into it.
Yeah, it's very moving.
It's very,
for sure.
yeah.
So if we haven't attended next year,
We should acknowledge that in this, that they do, that's you, and that's a really important,
Yeah, and we
our gratitude, Paul, for.
helped with the underwriting. The Human Services Commission gave $3,000 to help underwrite it. So they're very, very appreciative of us. Making that
What's the
city.
total attendance?
Yeah.
I guess roughly.
Couple hundred.
yeah, I would say at least.
Yeah.
Number.
I mean, the entire block was packed.
It was very full.
Yeah.
A motion to approve the minutes?
Here.
All in favor?
Aye.
Thank you. Reports, Jen Allison.
Are you getting comfortable with it? Congratulations on the town hiring a grant writer.
Yeah, well, I was one of the only ones writing grants. So we'll start off with vaccinations. As always, we've been doing the bivalent boosters. Total doses administered to date, we're over 26,089% population fully vaccinated. Now, definition of fully vaccinated is still the 2 doses. We're at 90.32%. And I should note the 0 to 4 category, even though for us that seems low, 30.75, that's in the top 4 of the entire state. And nationwide, I mean, if they're just blowing it out of the water, because that group is such a low uptake so far. We've been doing homebound still and mobile clinics. We've been doing Waveney, the Inn, the Care Center. We did Schoolhouse on Tuesday. So we're still making sure we get to all our vulnerable populations. We have a clinic today. We have around 200 again today. The last couple of weeks has been full with over 300 each Thursday. We did over 500 at the high school a couple of weeks ago. As I but it's students and teachers, only about 200 were teachers. The rest were students, so, and it's 12 and up because the bivalent has not been approved yet for 5 to 11. So we're telling parents hold off, don't get the monovalent as the booster because the bivalent should be approved by the end of October or early November. So they're better off making sure they get the most up-to-date vaccine. And for 12 to 17, right now, it's still only Pfizer that's available for the bivalent. But yes, we've had good uptake from the residents, so that's great. We are also working on flu clinics. We're doing one at the high school on the 19th. Janet Reed already sent out the information. We already have around 250 signed up for that. Again, we get the vaccine free from the state health department. We are in constant communication with Buchanan Pediatrics. They're doing about 10 drive-through flu clinics. So right now we're not planning on a kid clinic until we see that there's a demand. So we don't want to duplicate efforts or waste vaccine. So that's good news. Buchanan Pediatrics has hired a bunch of extra nurses to help with those drive-throughs for their patients. Testing, we're down with testing for the last month. You see the breakdown of the rapid antigen test. We did 34, 3 positive, so roughly 10% positivity rate. With the PCR test, was 116 with 11 positive, again around the 10% positivity rate. So, but we're still offering it. We know come November, when holiday season starts, it will pick up. Like last year, we got slammed. So this week's cases are around a dozen right now. I'm waiting for today's report to generate from the state. Last week we had 26, and that's on course with what this time last year was. Obviously, there's under-reporting with the home test. We all know that, but you know, you work with what you got demographic-wise. You see the breakdown by age, mostly in the younger generation for last week, the 0 to 9 and the 10 to 19. This week, actually, it's kind of different.
Thank you, Pam. And thank you, Jen, for the presentation. Very sorry to see Chris leave. I think we can all help and Human Services with miss him. He's been an immense value, especially during the time of high vaccine crunch with the hours and what have you. So I think it's a big loss.
I wholeheartedly agree, and I couldn't be prouder of my team, and we are a team. And unfortunately, right now with the public health jobs, it's become, we dubbed it the Hunger Games. Everybody's just, one-upping each other to steal people, so it's just the way it is when you have such a shortage of licensed, qualified people. And then all the certifications we need and degrees we need, it's not, a job where you can just hire anybody, sadly.
A report just came out that 1 in 4 nurse positions are open in the state, 1 in 4. So everyone is in the price of work right now.
Well, and we're also competing against the state health department that has hundreds of job openings because of retirement, and the state is still, mostly working at home with hybrid jobs, and they have state pensions. So it's hard when you're competing against these, entities where we're the boots on the ground, You can't exactly do a restaurant inspection or soil testing from home or a vaccine clinic from home. I mean, we could work with, the other hours, so maybe one day we'll get a 4-day work week too.
What's your plan for a search?
For what?
For a search to replace Chris? Do you have a?
Yeah, it was posted right away last Monday when Chris gave me 3 weeks notice. Because he knows I'm short, and Shannon's out next week on vacation that she's had planned out of the country for a wedding. So it was posted right away. We only got 2 applicants, one of which is in Texas, so that person's not viable because they don't have any Connecticut certification. And the other person I've known for decades, so we'll see what happens. But again, it's, what if their employer, says, okay, we'll match, and it's just the way it is right now, so.
It's hard to match a shorter commute time and 4-day week.
Yeah.
That's a nice thing.
Were you plugging for that 4-day week?
I was just plugging to try to keep our summer hours, even at 12:30, we couldn't get that.
Can you hire somebody that doesn't have all the credentials up if they are going to get them?
No, I don't have time for that. I don't have time to train someone. Shannon, we did that with, she got the septic phase 1 and phase 2. We've been waiting 1.5 years on the state health department to take her out for the food part, because the food part, you take the course, you take the test, but then, and you get trained locally, but then the state has to take you out for 10 inspections to certify you. And you have to work for 2 years before you can even take the RS test. So they would essentially be of no help to you.
Are the rules too onerous?
Well, the rules are the rules because we're dealing with complicated
I
things.
understand,
So you don't want to dumb something down, and that's where the problem's been.
but is that the issue, or is it just too complicated? There's a lot of overregulation of professions and across the country. It's a big issue. Making it unnecessarily difficult to get into the public health.
Not we as a
No,
town.
it's not.
As you-
State thing.
Yeah, the state, yeah.
No, and the state is working with the CDC on getting grants for workforce development. We're working with the
Okay.
universities in the state that have undergraduate public health and masters of public health programs to try to get them when they get out to at least have some of our certifications and do more what they do with engineers, where you do a mentorship program and stuff like that, because they're coming out of college with just a degree, which is not helpful to anybody. And, so it's been a problem for a while, and then the COVID just exacerbated it because, we had an aging workforce to begin with. And then with COVID and all the demands, people, retired, they're out. That's why the state has such a massive exodus as well. So it's on all levels. I get every single day emails from not only locally, but nationally for job openings. I just got one yesterday from Washington for Director of Health and Human Services. So they're reaching out everywhere. 2 of our health directors moved to Florida to be directors of health and not get income tax. There are many different reasons why people are doing it. But, you know, the state's well aware of the problem because they're in the same situation, and hopefully the CDC grants the grant. And hopefully the universities, you know, get on board.
Thank you.
Before we leave health, so New England Journal of Medicine reviewed the vaccines and what they've done to date. Just a brief summary is that the vaccines prior to the bivalent were more effective in preventing with alpha, beta, gamma, delta, the disease itself, the sickness, than the Omicron. But it did prevent the hospitalizations, the deaths, et cetera, significantly. The new bivalent has a significantly increased production of neutralizing antibody, which should be very helpful going forward. They didn't talk about the T cell or the B cell, which are things that are more long-standing and help fight infection going forward. So it appears.
Encouraging.
Next, human services.
Well done, Jen, thank you.
Thanks.
Okay. Everybody, good to be back. I'm going to start out with the staff report for adult senior population. Marcella Rand, so she is doing the energy assistance. We have quite a few more energy assistant applicants this year. At this time, she's done almost 30. And her Lapham Life Reimagined attendance, she has a full class. It's twice a month, and thinking of offering more classes. They want to keep it at 12 though. It's just a nice community feeling. And let me see, she continues the conversation with a cop. That has a huge attendance too. She has increased the vulnerable population list, which we want during this time of year. We will be at various flu clinics, which I'll go into, but she will also be there signing up people for the emergency vulnerable population list. And that's just in the event of a natural or man-made disaster, whatever, we will contact these people. There is a protocol set in place. If they do not answer their phone, we go to the emergency phone numbers that they've given us. If they do not know or cannot get a hold of them, then we do have a first responder go out to check to see. This has been proven very helpful. We have had some calls where people have not needed any help. They were out of town and never notified anyone, to basically coming in the house and seeing someone in medical need. So it's definitely something we continue to promote. And it is on our website. You click on it right there when you go onto our website to sign up for it. But we're constantly following up with the people on a yearly basis, even if there's not an emergency event. Her home visits, she continues to do the home visits, and she's working with a couple adult protective services situations, cases, reporting and fire hazards, and working with the fire marshal. And reporting is a huge issue, and it's a very difficult issue for resolution. It's more about trying to keep things on a path to resolution. Jackie, she currently, her caseload has increased significantly. She has 171 kids now, with 106 guardians. This is up. She had 80 some families. Now she's up to 106. Ukrainian families have come in. The qualifications in terms of loss of job, income insecurity, food insecurity, a lot of insecurities, and people are coming to human services. The schools, she works so well with the schools, and that is, really hands-on. They see things on the front line. They come to Jackie and they start working as a team. She's had 3 DV calls which is a lot for 1 month. Doing the supported Unite for Ukraine families. And she is working with the public school social workers to help many, many families. And they don't necessarily become clients of ours, but she is getting resources for the social workers to pass on to them. And if they don't want to come to, they have a right to determine whether they want to come to human services or not. And if they can get enough through the social worker at school, for the meantime, a lot of them do come back to human services at some point, but they're trying to not.
Do we have any count on the number of Ukrainian in town?
No, we have had 5 come in. Now, it doesn't, there are agencies in we're in their catchment area, but we have had 5.
But that's not part of the 106 guardianship that you have.
No, because we just send them,
Agreed.
yeah, we get them through to other agencies and things like that. The housing is hard, but people, churches, organizations are sponsoring them to come here, which is great, and they don't come to human services.
Well, I think with the increased outreach that we've had in domestic violence, we certainly started that, this commission did
Yeah.
several months ago out there. Maybe that is bringing more awareness to it, could be possible. But the 106 kids in guardianship, I mean, that is, to me, that's an alarming number for our community.
Yeah, it's really about energy assistance. It's the fuel, the fear of the winter coming. They're applying, kids at school, the camps and the sports are getting more expensive to have your kid enrolled, your child enrolled. And these travel programs, things like that. And our goal is we want these kids to be able to continue that. This means scholarships to colleges and things.
Uniforms are $1,000.
Uniforms, yeah, the travel things, and we want them to know that, you know, we support that as much as we can, and through the other resources, Catholic Charities is a huge one, Community Action for Western, Agency for Western Connecticut, we can pool money together and we can get these needs met. They also have to qualify, and they do. We're not, if they have to qualify on their situation, you know, if the father's out of work or the mother's out of work, the kids are not employable. We put everything into factoring, not just their bank statement. We don't want, you know, their savings account, things like that, you know, it's not up to us to say, oh, pull out of that and then go that, you know, there's a little bit of dignity we want to keep involved. But if we can keep these kids on a path to education, higher education.
Yeah, I guess my definition of guardian is different, so.
Oh, parent, 106 parents, I like to guardian, I like just to be, I'm being.
When someone's in guardianship, has a different meaning.
It includes parents.
Yeah.
106 parents,
Gotcha.
guardian, yeah, exactly, I'm sorry,
No.
I see what you're saying.
Yeah,
Parents and guardians. Yeah, but we have quite a few grandparents that have the kids now. So
The driver of the uptick seems to be mostly increased financial strain.
inflation, energy, yeah. It is, and then and wanting to maintain the level for children, it's the sports, I mean, really, that's their ticket to a college to. And so, and then, let me see, the domestic violence proclamation will be on Thursday, October 13th in front of Brookhaven High School. So Jackie has that, passing out bracelets, things like that, and Graham Council, yeah, that whole thing is going to be a nice proclamation. Okay, so that's Marcy and Jackie. Our paces, you know, they are
Can
up.
I interrupt you, because it's a question about Marcy. When you say that she's got more vulnerable population, how is she identifying? Are they coming?
Combination, so she is anywhere we can get when people come in for energy assistance. I mean, she's had 26 energy assistants.
Okay.
You know, we ask, it's a constant whenever she goes to Lapham, whenever I do a blood pressure clinic. The next week's Lapham flu clinic, we have over 100. You know, things like that. So we're promoting it. It's on the website. We're always promoting it.
And are people pretty good about giving the emergency contacts? Yeah, good.
Oh, yeah, they really like it. She works with Staying Put.
Right.
So getting the word out there, Lapham has the applications, they put the why, yeah, we have it, it's out there. All right, so for my report this month, food pantry and blood pressure clinics, we continue them as scheduled, participation is consistent, and we are topping previous numbers. So excellent to see. We have 2 evictions, one last month and one this month, and they are evictions. I mean, they're unfortunately having to go out, and they have moved their things out. It's not the town. We had to do one in August where we did have to keep all the I think it was schoolhouse. He never picked up his items, so we came and had to do clean up. Anyway, and that's sad to see for the 2 in September and October. They are families, so we try to offer them support and dignity. And that's an ongoing.
Where do they go?
They usually go to family. South Carolina, somewhere warmer weather, less energy, assistance needed, you know. It all depends on where their family is. Okay, so I've started the preparation for the upcoming budget season. And grant requests, which we will get to, is an area of discussion. I have sent the request out last week to 10 agencies. We did, that's 4 more than last year, and but I'll discuss it at new business of why we invited these 4 organizations to come in and see if they wanted to request any grant money. Emergency preparedness is coming along with Russ Bart. Honey, you're on my mind. With Russ Hines.
I'm in.
Russ Kimes is doing a great job coming in as the full-time emergency preparedness coordinator. And we've done a 2-day hurricane tabletop exercise. And we've done a 2-day FEMA training focused on sheltering. So Human Services will have a key slot, the sheltering, and Russ is working on that. Once a place is put in writing, which I think it might be, then we'll start logistics and planning in the event that we need to use shelter. And it's interesting for a shelter, the Red Cross uses a formula, just to give you an idea. So we have our population of 20,000 in the event that it's temporary sheltering use, or they look at about 10% of your population will be needing temporary housing. Okay, so 2,000 people need temporary. The others they go out. Of those 2,000 people, potentially 1% needs long-term sheltering. So we look at that, not that we have to plan on 20,000, but most likely with the statistics and evidence base, we'll probably be thinking maybe around 2,000 at the height. And then those 2,000, probably, you know, the 1% will need to find long-term sheltering. So all that is put in mind in terms of when we look for places and inventory, things like that. Stocking up on items. Let me see. Last month, I participated in Lapham. Aggie had an emergency preparedness panel discussion, full house, and that was a wonderful way to sign up people for the vulnerable population list. That was a very, very, great. Aggie put a great panel up there. So behavioral health. Marcy and I have become certified with the Weill Cornell Institute, completing the interview for decisional abilities program. So it's evidence-based. It's like a semi-structured interview tool. So we can, Adult Protective Services, they want it to be used by them, but we talked to Weill Cornell and the head of the program, and she let us do it. And so we took the class, and it's about gathering information from a client through a conversation to see what their decision-making abilities are. And we try to accurately capture where they're at. We're not diagnosing for dementia or some type of
Can you
altered
give an
state.
example of something you would ask that would be part of that?
Okay, let's courting situation. Someone comes in. And I mean, someone calls Adult Protective Services. We go out with the caseworker. And first of all, we want to see universally, is that person understanding their situation? So we would ask a question like, have you heard about people that collect so many things during their lifetime that now their house is so full, it's very difficult to walk around? And someone can get injured. Someone would say, oh, I mean, I've had this, I've done, yes, oh, yes, it's just, you know, very dangerous, someone can fall. And we said, do you know of anybody like that? That would be categorized, or, you know, that might do that? And they say, no, I don't know of anybody. And he said, have you seen, okay, so let's look at your situation. When you see all these wonderful things that you've collected, what do you think? Oh, I'm totally organized. I know where everything is. This is totally different than what you just talked about. So it just gives you an idea of where they're at in terms of their right to self-determination. Whether they have a right to live that way, or there's something cognitively wrong and they're putting themselves and others in danger. In this situation that I had to work with, this was in a multi-family housing. This woman, I mean, it was a fire hazard. She was sleeping by the front door because she couldn't get to her bedroom. That was the only space she had. And she totally thought her house was totally organized. But for someone to be living in a messy situation, that was totally different. That was dangerous. So it just, it gives a baseline for all of the caseworkers to see where this person is coming from. It's a decisional ability making tool. Nothing else. So we're, that has been very helpful. Let me see, next thing, urgent assessment program for Silver Hill that we gave a $250,000, the town did, ARPA fund grant. And it's going very well. We have a monthly steering committee, which is comprised of the New Canaan Community Foundation, Lauren Patterson, and somebody else, maybe, and then Silver Hill attendees, which is the head psychiatrist, the head caseworker, the community outreach, Andrew, another psychiatrist, and then Kevin, myself, Tucker Murphy. So we do this on a monthly basis. Right now, the total calls that have come in since the July 11th launch or July 7th launch, there have been 43 calls, and which has come into 36 actual cases. And so they're averaging 3 to 4 cases a week. There were 5 this week. This is, I just got this last night from Silver Hill. And there were lower than average weeks in mid to late August, which is consistent with all types of services being asked for at Silver Hill. So it's following the same curve. Most calls have been turning into cases, as you can see, 43 cases. 43 calls with call-ins, 36 cases. Most inquiries have been appropriate and on target for what the program is. And that's becoming more and more true. It's likely due to the word of mouth of what this program is now. That's been launched. People are understanding the qualifications. Age range has been from 11 years old to 82 years old. Primary complaints, depression, anxiety, followed by suicidal ideation of varying degrees and severity. Substance have been proportionately fewer than what they've expected, but we've seen a few cases where it was a primary concern. And 3 to 4 have been referred to an inpatient level of care, 2 to 3 to an intensive outpatient, and then the others individual therapy. They have been partnering heavily with the middle and high school since September. So it's wonderful to see that the Board of Ed, the schools have been, they're totally latching on to this appropriately for potential resources for their students. And then on October 11th, we will have the New Canaan Behavioral Health Alliance, which we have every other month. And that is for professionals in the area to come in to Silver Hill. And we last met in August, next one, October 11th at 1 p.m. And we just meet, we discuss, we don't, it's not like an education, they all know, they're all professionals, they're all in this case working in behavioral health arena. But we get their feedback, they ask us, it's a very round table. Excellent. I mean, Russ, you were there, I'd be able to speak up and get the word out or whatever you need. And I think Russ has been invaluable in terms of the older population.
And even with our employees, when we get to the point of marketing, this is mental health month, October is.
Yeah.
And so we're offering programs, you know, we Jen talking about the stress level coming through COVID and still dealing with it. Plus the shortage of staff that exists across the country in our areas. So Silver Hill is actually coming in and presenting to our staff at all 3 divisions and at all different times of the day, because it is an issue for burnout. It is an issue for anxiety and stress. And while we're moving from a pandemic to an endemic, you know, you're talking about people that have worked, you know, 5, 6, 7 days a week, 10 hours a day, and it takes its toll after a while.
Yeah, I'm wondering. And this is really impressive what's happened, and I think it's a great program. I think it'd be really interesting to have Silver Hill present to us, like with data and insights and maybe broader recommendations of other tactics that we can think about and advocate for building on this success. Because
Yeah.
these numbers are,
You don't want them, but obviously
you don't want them, but wow, this is,
it shows that they're
no,
needed.
this is real
This is
real
real.
data and
Yeah,
I'd love for us to kind of collectively learn and go deeper and figure out other tools that we as a commission can advocate for, you know, learning from them to say, okay, if you were kings of the world, what other things could the town do, given the shape of the cases or that we're.
We have great attendance at our meetings. I mean, we're doing four meetings a year or 5 meetings a year, something of that nature. And we have those kind of discussions, Peter. I mean, there are 50, 60 people there and open from all representing all age groups. But I would agree, I think it would be helpful, especially when we're talking about grants and marketing, other programs, if we can give another boost in the arm to some of this outreach.
Yeah, this is evident. I mean, this
Yeah,
is-
no
these
question.
Well,
numbers
it's something,
show
a stigma. The stigma issue is not as significant where you've got these kinds of numbers coming in, and the fact that these numbers are moving forward.
Well, I think part of it helps, you can contact Silver Hill direct. We don't need a town agency involved. So they have that complete confidentiality. Because I've had 2 people in the last week come to me and I gave them all the info. And they like that. They like that they can just deal directly with the provider.
But that's my sense, there are huge learnings.
And I think that needs to be more broadly communicated. That, you know, you can just call this number if you're a resident.
Well, yeah, when they call us, we tell them to call Silver Hill. And the numbers I just gave you, this is the only thing we get from Silver Hill. So that, you know, the confidentiality is totally intact. And they don't need to call us. We're happy to give their number out, but it's the police, it's everybody sending the person in need to that Silver Hill number or website. It's not going through, you know, at that time of crisis or pretending. You want to go right to the source, and Silver Hill has done an unbelievable job with that.
I mean, I know, like from the hospital perspective, this first point of contact has been a huge problem with all these agencies and resources, but nobody knows where do I go first?
Yeah.
And all of a sudden, I think we've kind of stumbled onto something that is actually becoming that safe
Yeah.
place to go.
I just think that given the numbers and given where the economy is and given the stresses that we're seeing on families, I'm hopeful that we have enough resources, because there's a limited amount of money and a limited amount of bandwidth that Silver Hill is going to have. That's my concern going forward, and we haven't reached that point yet, but we can see the pot percolating,
Yeah.
so to
And they
speak.
wanted this, I mean, they were hoping, they wanted to get out in the community, and now maybe. Yeah, we are responding, but it's fantastic, but yeah,
Do you think it's timely for them to come report at one of our upcoming meetings?
we could do it this way, I mean, the community director is leaving next week on maternity leave. And someone else is gonna be filling in for her. I don't know if they're able to, at the same time, maybe I could get the power.
Dr. Gerber, I think, would love the opportunity to sit and talk, just get on this calendar. Getting on this calendar is always the toughest.
The toughest thing, let me see,
Is that Susan Lewis?
Suzanne, yeah. That's a big, so, yeah,
Along
so,
along these lines, so the former patient of mine, mother contacted me, because she was worried about suicidal ideation comments, her teenage child. And so I did, it took a few phone calls to Silver Hill in the day on the phone and back and forth. But once the connect was made, it was seen the next day, moved on with, and so that's the.
and what Silver Hill is said,
benefit of that. The other thing is, I don't know if you've seen in the press or in the media, empath, EMPATH. So you may know something about this, Russ. So this is, it's emergency psychiatric assessment, treatment and healing. And so it's growing nationally, and it's dealing with a lot of the things that Russ mentioned, which we're familiar with related to COVID and not mental health issues. So there are little areas of hospitals and clinics and other things that are being established to deal with the need in this country. So it's the equivalent of what Silver Hill is doing, maybe not as upscale as Silver Hill, but, and that's the thing. I think Dr. Gerber was afraid of maybe too much too soon. So we kind of put the brakes on, was talking about maybe 5 cases per week.
yeah,
And so
We
they're
did
doing
that.
that, they're almost that, and as successful as that will be, it'll only grow, and then when it's, 3 to 4 per week, and if you end up in extended treatment and those numbers keep growing, it will gobble up as.
well, that's,
One of the other things that I would recommend, and we have an extensive employees assistance program, and marketing that program to all of our employees. I think we can also go back to all of our employers that are in the area and promote them adding employees assistance program, because at some point in time, we're already hitting 5 a week. We're going to hit a bandwidth that I'm concerned. I think Dr. Gerber would be the best person to say what that bandwidth is.
Getting out ahead of it, to me, is the key. There's enough learnings that we've got now, and anticipating, I think everybody's making a great point that this will probably grow, but then now is the time to start thinking about that. And I do think there's a real opportunity for philanthropic funding here, because
we're gonna need it, and they're gonna need it because they're gonna,
It's a 1-year grant, so we're.
we got till July 6th.
Exactly.
Probably start planning now.
Yeah.
There are towns that are interested, but as Andrew says, and Kevin, I don't mean to speak for them, but I have agreed with the conversations.
Yeah.
You bring them on, and then there go your 5 a week. I mean, now you're splitting 2 towns, as much as we would love the money. Now you're bringing in another 20,000 population. So do we can we fund this alone through philanthropic entities here, and keep it within New Canaan? I don't know where to go. Where does Silver Hill want to go with it? So there's a lot of discussion.
So I think it's apropos to have Dr. Gerber come and talk about the bandwidth that they're going to have. That, they're just like any other healthcare provider. They still have their own difficulties recruiting staff and therapists and whatever. So it does become a bandwidth issue. But I think, as we're talking about marketing, mental health, domestic violence, I think all these things that are starting to percolate, that we've got our hands around some real data right now, all are red flags, right? And if we have funding that's going to be not renewed in July, then we don't have that much time to figure it out.
Right.
But
And
there's a proven technique here
Mhm.
that is working, and that gets me really excited. It's like
Working
the
so far.
But this,
Here's gonna be the crunch point is. Silver Hill is the triage, first level of appraisal and whatnot. They send them on to a referral. The practitioner who's gonna do the hard, heavy lifting over a period of time. That's a big crunch point across the state. Is having a number of practitioners
So
available.
that's why we're doing this
Do that.
behavioral health alliance. It helps Silver Hill actually. It's networking with the area workers, in terms of, caseworkers, social therapists, counselors, inpatient facilities, things like that. Because they want to be able, part of their deal is to do a gentle handoff as quickly as possible when they really feel and a plan is put into, not into action. When a plan has been devised, now they have to put it into action and to be able to call these local area entities directly to get this person help.
But it's also a systemic problem, because when the insurance industry is not recognizing and paying for it, I know, I'm going through it with mental health, with psychiatrists. That's where our other leaders need to get involved and get, because,
Yeah.
when you pass them off to another provider, New Canaan has the ARPA funds right now. But, ideally, insurance should start picking up
But it does,
some of it.
yeah, and it does, and it's finding those resources, that we have. But we need access, Silver Hill needs access to them. We're working with Silver Hill in terms of getting those that take Husky, those, things like that. So this, alliance is excellent for that, but the bottom line is being able to pay for this for another year and then another year,
so there's an
But again,
ecosystem.
I would
This is
work on the insurance industry too with politicians.
figure out.
Yeah, it's a bigger problem.
Yeah.
And it's-
I think the short-term answer is philanthropy.
Yeah.
Insurance companies, they've been pushed by the government and it happens very slowly.
But there are a lot of mental health businesses out there changing.
So this bigger
Right.
problem,
Oh,
which
yeah.
we're not gonna be able to solve, but this access point has always been a huge issue. There's a real success on that. And I don't want to lose, there's huge downstream issues which we're gonna have to deal with, but how do we make this more institutionalized? Because I just know this has been a huge problem. Certainly the hospital has been dealing with this forever, all the agencies. And nobody, it's a complete alphabet soup. And now here, there's a central point. And that's something. And I think we should celebrate and build on that and then start working on the other.
No, I think it's great what Kevin's done with, bringing this program to, most other towns. I said to Kevin all the time, I wish every town did this with ARPA funding. I wish the government gave criteria to the ARPA funding, because it is a national issue and it is a huge problem. And I think it's great that it's working so well,
I agree with
Yeah.
you. I mean, I'm literally with the insurance commissioner once a month because the managed care plans not paying their fair share. Things like that. So that happens, that's not a problem we're gonna be able to fix before now in July. It is a huge problem. I agree with Jen. But I agree with Peter that I think let's find out what their bandwidth is. We have between now and July to come up with a recommendation on how we can continue funding it. But I also need to challenge the employers in the town and surrounding communities to offer their own employees assistance program. So that can help diffuse some of the volume that exists.
Right, because like the town of New Canaan has an EAP program, Kevin and our HR director promote it at every staff meeting. And it's not just for the employee, it's for your family as well.
Yeah.
So to your point, I think that's, but ultimately, everybody getting referred, there's still only so many mental health qualified. Yeah.
Great discussion, we could continue this forever.
Okay, so
Let's go to old business.
business. Yeah.
Okay. Thank you, Beth. Old business marketing, okay, why are we marketing? I think there were some questions that were raised. Lauren Patterson, when we started meeting with the Silver Hill thing, commented about how HHS should be marketed in the community. So she's gotten that kind of feedback. David Hunt, I'll use their names. He's been involved on a number of things that was with Waveney. commented that people in New Canaan only think that HHS is for poor people. And plus input from the commission about what the community knows about HHS and what HHS knows about the community, et cetera. We thought, well, let's go to marketing. Let's make sure everyone in New Canaan knows who we are, HHS, and what's available to them. So we looked at this marketing issue. So we had the New Canaanite, we had the advertiser via Hearst, and something new with Golden Years. So let's,
Okay, so the Golden Years is it comes out twice a year with the New Canaan Advertiser.
Right.
And in the whole catchment area of Fairfield County. It's this October 14th through 16th. Harrison, if you want to pass that down, I worked with for $870, it's a quarter page. We can have this in the Golden Years edition. They will not do color, things like that. And color is another, I don't know, $400 or $500, you know. Anyway, it doesn't pop out, but it is going to be there. $870 for that to run October 14th through 16th in the newspaper as well as their online. And it's very basic. I'd like to run this in the Canaanite as well, maybe once a month. I don't know. We don't want to spend a lot of money.
yeah, it's about, to do 12 months was about 3,600 in the
Yeah.
New Canaanite, and the same, or put those numbers in the advertiser. We could do 6 months, we could try it every third month, every quarter.
The advertiser, and they both said, both sites, the media sites said, however we want to do it, once a month, once a year, whatever, we'll just, but we do have money in the public health marketing.
We had talked about maybe having a message each time you do something like that, but did you know that, I mean, I don't know whether that's.
But that was the education thing. So Russ mentioned education, like, you know, maybe we should use this as a venue for educating about this. And Tom was in accord with it, Jim also. But honestly, once we start giving information, now I think Bethany thinks like I do on this, you open yourself up to, first of all, what education on supply, or then the questions that will come in, the controversies. You would need another person to do this on a full-time basis if you're going public with all sorts of information. I mean, that was some of my little previous experience with McKinney Pediatrics when we went public with information, even the vaccine. So you get the anti-vaxxers and what have you, and they're, you know. Yeah.
But I'm hearing two different things. So the first thing I'm hearing is that people out in the community do not know what Health and Human Services does.
We
Right.
want to make sure everyone.
Okay, so this, to me, this is almost a yellow page ad. This does not tell what Health and Human Services does. It says, we're improving lives together for an appointment, here's office hours, and here's a number.
Well, that's only human services.
That's not telling the community what
Specifically.
Human Services does. So this is a yellow page ad. This
Yeah,
is not
that's all we can do.
this
for
is
that.
not
It's an ad.
more, which was your goal, and that is to tell and inform the community on what we do. To me, this, with all respect, this does not do that. This is a yellow page ad of, this is our phone number and these are our hours of operations.
But why couldn't, if it's done monthly, why couldn't there be a little featured thing? You know, 12 things for your, you know, did you know, this is one area, this one area.
I mean, I think that'll be about $6,000 a year.
You know, but they like copy, they like someone else to write their copy. You could just write.
That this is part of it. The other part of it is, you know, when you work with First, they'll write human interest
Right.
stories for you for free. And maybe that's where we do some of the education to it. But
Like
for me, I think we all agree that we wanted to educate the community on the services that Human Services provided, right? That was number one. And to do that, we need to educate them on precisely the services we provide.
But right now, we have 4 people on the human service staff,
Yeah,
and how many on health department, similar number. And we kind of keep a low profile, you know, based on the feedback we're getting. if we raise the profile, we're gonna get more calls.
Well, I don't.
So if we-
I put everything out there.
Pandemic.
Now I sit there all night long responding to the emails and
So if we do more education, more publicity, make ourselves better known, it probably will increase demand and. it's trying to-
It may and it may not. I mean,
Yeah.
we don't know exactly how many people know. Why don't we try a pilot for?
But if it does, that's not bad. It does
Yeah.
mean. there's
Demand,
money.
demand is the issues in the community, that is what is. And we need to know what it is, you know, and, so
I mean, it's, you know, the staff, I mean, just the two caseworkers, right? We, in terms of doing a marketing campaign, and doing it well, I don't know if possible, if the commission wants to do it, to form a committee to do this, a Health and Human Service Commission. I don't have the time to do.
How do you feel about getting, I mean, I think we could all help, I think that's part of our role is to help, but how do you feel about getting incremental requests? Do you feel like your staff can handle more? And I think that's kind of what you're asking.
We just,
It opened up.
based on the feedback, we just want to feel comfortable that everyone in the community knows that we exist and what we do. Well, the other thing, our attorney is there. They are very busy. Marcy and Jackie and Bethany are very busy. So.
Yeah, I'm.
Writing email here. We know that.
So that's speaking, that's a dichotomy, right? You're saying they're
Yeah.
very, very busy and yet no one knows what we're doing
No,
in the
no,
community. That's
No,
feedback. I
we're
don't think that's-
busy, but we want to make sure everyone knows because there has been some feedback that some people are. Think we should be marketing more than.
And that's
Some
been
people
feedback
aren't really
by
aware of what we
people.
do. But it's only for 4 people, this, that, and the other thing, and so we just want to correct that.
And I think the past couple of years, we have been getting that out more, as we partner and collaborate.
Well, the
And-
telehealth program originally was designed because what we were getting 10 years ago were only people with their hair on fire. Mom is ready for the, et cetera.
We need more news stories on what's going on. And that, one way to get free publicity is to actually say you're doing stuff.
Yeah.
Right, like the fire marshal does with his items in the New Canaanite. He'll do a letter to the editor, college fire safety, in the winter he does, you know, the chimney safety. So if you have a specific thing, you could always do a letter to the editor of the New Canaanite.
I think for the sake of time, let's make a decision about. Golden years, number one, if we want to put this in, or
It's in.
it's a.
Kevin saw it.
That's easy, okay. And then, the new Canaanite and the advertiser, if we want to embellish the marketing issue and do that.
Another thing I would add about New Canaanite, and I'm sure like Channel 79 as well, is we have more flexibility. The paper wants to be black and white, it's not first point, and we're kind of limited, but we can make the more online advertisements more exciting, more interactive, and we can adjust them as we go.
Look, we can also do a letter to the editor as a commission that says, here are the services and programs that we provide. It is absolutely completely free. And here's a letter from the Health Commission, maybe a summary of the last 6 months, the issues we've come across, what are great departments that are doing health and human services. And we do a letter to the editor, and we do it with the frequency that does coordinate all the services that we're doing, which goes to the next point, in that it's getting back to our setting out priorities. And I think that way you communicate your priorities, you communicate the things that we're doing, and it is completely free.
Right.
So.
You like that?
Yeah, I think that's a good idea, and we can actually blow that up. Not physically, but in terms of size, take it, letter to the editor, one page of the advertiser, and or the New Canaanite, and go from there, so we can work on it.
I'll make the motion that it's in the golden years, even though we don't need to.
Yeah, this was an email. Like I said, this was an email sent to Kevin, forwarded to me, just say, make this happen, so.
Fine.
done.
Okay, next item, role of the commission. So we discussed the oversight, the advisory role. The advisory is to advise the community what we do and also get the feedback from the community as to what the needs are, the unmet needs, so to speak, and discuss grants, priorities.
I think
What we find, what we
meeting
don't
and
find.
have that discussion for the whole meeting. After a short staff reports, that's gonna be some, everybody's gonna have an idea.
I second that motion. Good idea.
And also other topic areas that should be within our purview that we should be weighing in on, kind of a
Yeah.
blue sky sort of discussion that are around the edges
Right.
that have health impacts. As part of that discussion too.
Okay, we will do that at our next meeting. Domestic violence, I think we covered the topic. The speaker was great. Bethany mentioned October 13th at the high school. Kevin Moynihan and Dee Dee Bartlett. Dee Dee has been very involved with domestic violence. There will be speakers amongst others, I think. October 21st also is domestic violence, their Harvest Festival, which is at Shore Haven, and that's their major fundraiser. So that's that. New business. Bethany alluded to the grant request for 23. Want to just discuss that?
Okay, really quickly, I went through with the caseworkers, the organizations that we utilized this year, and the 4 new ones that we did incredible partnering with: Catholic Charities of Fairfield County, I'm sorry, I know I did that, Community Action Agency of Western Connecticut. Both those agencies help with security deposits, first and last months. We cannot, as a municipality, we cannot pay forward a security deposit and have that money sitting there. We can pay past bills, something due, but we cannot pay forward. And so this is a lot of money. They have come forward and helped the Ukrainian families, the many families that were moving into Canaan Parish. And now Canaan Parish in November is started from yesterday to October 17th, taking applications for their 40 units for affordable housing. And we're going to be, those people that we will call, those new residents will qualify for energy assistance most likely, because they can only make one person to qualify can make between 33 and 56,000 a year. And if you make that much, you're gonna qualify for energy assistance, and then it goes up in terms of the number of bedrooms. But it's still, you're gonna be working within a guideline where they're gonna be coming to us for energy assistance. Maybe not food pantry, but definitely energy assistance. So that one, Elder House, they now apparently they have quite a few residents from New Canaan. They are doing everyday drives apparently, and they are asking for help. And then the other one,
Elder House, is it dementia? Is that like an ADP program?
yeah,
Yeah.
adult daycare program.
It's in Norwalk?
Yes, it's in
Nice-
Norwalk.
nice facility.
And family centers. Family centers help with suicide, as we partnered with Darien this year for their losses. And just showed us that what we can use, what we want to use them for is, I don't want to say use, what we want to partner with them for is using, doing Zoom or support groups. We're having a hard time finding enough people who during a certain amount of time that pays for support groups. But Family Centers is working with us and trying to get a time, and they will get counselor, therapists on staff to do a Zoom meeting or to meet. The churches have offered their space. I mean, we've got it all there, but and Family Centers is willing to be put in that pot and go where the most, the easiest, largest population can go for that support. So those are the 4 new agencies. Last year, we gave $174,000 in grant requests. If also Kids in Crisis last year they asked for 85,000, we gave them 85,000. This year with the increase in cost, they might be requesting 111 to 115,000.
But they just, one of the things that you brought up, I think it was about 6 months ago, was clergy coming together to support divorcees in counseling. And did they ask for any money to support that group or?
Well, who's they? You know,
The-
clergy?
Yeah, or any of the organizations that were coming together in.
No, and Jackie's been talking with them, they'll offer their space for no charge, which is.
But that's
good.
it, okay,
Yeah,
okay.
yeah. So if I take an average out, like 5,000, which we usually grant the smaller agencies, coupled with the kids in crisis rise in costs, might ask for more because of gas prices. We might be going from 174,000, I possibly am estimating 221,000 for requests for grants. But we can go through each. I asked, they have until November 17th, these agencies, to come forward with their grants that they'd like to submit, and then I'll present them to you all. To see
You
what
think
you-
they'll apply?
Oh, yeah, they called me. And I
But-
think
but-
that was,
So we need to anticipate possibility of.
and last year at
Budget
the
job.
Board of Selectmen, council finance meetings, they all said, you stayed at 174,000 for years, why aren't you going up? And I said, well, I can, but you.
You told me.
You told me not to, you want to keep everything at zero, but hey, we've got needs, so I'm going out on a limb and really asking for it.
Kids in crisis thing, that doesn't include the junior high class.
Okay, and that's coming down the road. The Board of Ed offered to pay with their ARPA funds for 2 years of that.
Oh,
So next year, the middle school kids in crisis T-top counselor, we have 1 more year of the Board of Ed paying. That is going to be added on. That's another 100,000. So, but it's,
that wouldn't be part of this next fiscal.
no, it's not.
Right.
I'm saying that for the next fiscal year.
Yeah.
But just keep that in mind, if this will be great for the commission to advocate for that, because
We
apparently,
should have a really informed point of view and make a statement about improvement and all of that,
But
about what we think is necessary.
necessary, so I think having the kids in crisis, the teen talk counselors come here.
Right.
When it gets closer for something like that, I just want everyone to be
Is it
educated.
appropriate to have Brian Lutzy come and talk about what he sees as needs and things of that nature?
Time wise, I don't know, he's not, but maybe, student services, Susan Bliss.
Probably Susan Bliss, we did have Greg,
Greg Sloan,
Sloan, he,
teen talk
3
counselor.
or 4 commission meetings ago, he spoke to.
I just want Brian to be able to, tell us all of the programs that are out there and where is he seeing movement and what is supportive and where does he feel there's gaps that, to give us an educated opinion on what to fund to assist, so.
We'll consider.
Okay,
Yeah,
should make a motion.
I think our.
Okay.
Just let the record show. I made a motion to approve the posting.
Yeah, right. Yeah.
We adjourned, Mr. Chairman. Oh, wonderful.
This is still recording.
Yeah.